And it can be argued that the most powerful men and women in the country right now are not our elected leaders, but the public health bureaucrats who can shut down entire cities and states, profoundly impacting the lives of millions. Chief health officers have gone from middle-ranking bureaucrats to wielding enormous power. And it's uncanny how closely they seem to mirror their respective premiers in temperament and competence. Take New South Wales Chief Health Officer Dr Kerry Chant. She is not one to seek the limelight and gives sensible, fact-based analysis without indulging in politics or hyperbole. You won't hear her talking about beasts or engaging in wild conjecture that needlessly terrifies the population. Dr Chant's advice has helped New South Wales record the best outcomes in the country. Likewise, the New South Wales Premier, Gladys Berejiklian, has been level-headed and competent throughout this pandemic and has outperformed every Premier as well as the Prime Minister. This week, as New South Wales learned of a positive case from Victoria being in the community, the Premier refused to indulge in the blame game or panic and again relied on the state's world-class contact tracing to do its job. In contrast to the New South Wales gold standard, Victoria's disaster-prone COVID response has seen the state's health bureaucrats thrust into the limelight. And frankly, some appear to enjoy the attention more than others. Before the pandemic made him a household name, Dr Brett Sutton was writing about why climate change matters for public health. The current climate emergency is the single greatest threat to global health into the future, Sutton wrote in 2019. And there was this on the critical role of public health in driving action on climate change, published in 2020, where Dr Sutton wrote, "The climate crisis is a fundamental threat to public health." This week, the doctor and COVID-19 testing commander Jeroen Weimer seem to be competing with each other in coming up with the catchiest, scariest term to describe the Kappa variant of the virus. Now, Weimer doesn't even have any medical expertise. He has a background in transport. But that didn't stop nightly news services from amplifying his claims about the virus spreading faster and in ways we've never seen in this country. A claim that has since been disputed by a number of infectious diseases experts, including Professors Greg Dorr, James McCall, Peter Collignon and Catherine Bennett. Professor James McCall said, there is no evidence that this virus spreads faster. There is no clear reason to think this virus is spreading in different ways. Now, I quoted the professor's comments on Friday. The quotes were published in The Age in an article with the headline, "Scientists find no evidence strain is fast-moving beast." But after I quoted the professor word for word and in context, a curious, some would say bizarre thing happened on Twitter. Professor McCall claimed that I had completely misrepresented his comments. He also said I strongly and unambiguously support the Victorian government's response. My comments on the epidemiology, which you did report on, do not imply the policy response is anything other than exemplary. Now, I'm used to straw man arguments on Twitter, but not from a professor. For the record, I never suggested that you or any of the other experts named didn't support the current lockdown or indeed the Victorian government. I merely quoted you disputing the claim that this virus is spreading faster and in new, unexpected ways. I know we live in strange times, but frankly, I never thought I'd see a professor claim that his comments being quoted word for word and in context amount to a complete misrepresentation. I do find it interesting that the professor says that the Victorian government's COVID response has been exemplary. It's an interesting description of the state that has had 4 lockdowns, one lasting 112 days, and is responsible for 90% of all COVID deaths in Australia. But that wasn't what Friday's editorial was about. It was about experts, including you, Professor, very clearly and very strongly disputing the claim that the Kappa variant was behaving differently. Anyone who actually watched or read the editorial would know that. Why you'd feel the need to correct something that was never said or even suggested is frankly beyond me. Perhaps being quoted by a Conservative commentator is unsettling for some folk, but Victoria's health bureaucrats were so hyperbolic with their language this week that even The Guardian was doing an excellent job in reporting their claims were being disputed. It's not just Brett Sutton, though, who has been lambasted this week for alarmist rhetoric about absolute beasts and recklessly inaccurate comparisons such as measles category of infectiousness. For the record, measles is so highly contagious that 90% of non-immune people exposed to an infective individual will contract the disease. Now, that's according to the European Centre for Disease Prevention and Control. No COVID-19 variant observed anywhere in the world is even in the same suburb, let alone the same ballpark. And talking about balls, South Australia's Chief Health Officer, Professor Nicola Sporia, also grabbed national attention this week with her bizarre ball advice to footy fans attending the Crows Pies game in Adelaide.
We're looking at the seating at the moment, and of course we're looking at the ball, because sometimes the ball, not that I've been to many football games, I have noticed occasionally it does get kicked into the crowd, and we are working through the details of what that will mean. If you are at Adelaide Oval and the ball comes towards you, my advice to you is to duck and just do not touch that ball.
There you go, folks. This is what counts as sober health advice in 2021. Don't touch the footy because it could have been touched by those diseased Victorians in the Collingwood Football Club. After going viral for her comments and being mocked on TV and radio, the professor claimed the following day that the comments were tongue-in-cheek. Now, did that sound tongue-in-cheek to you? Sadly, the ball advice doesn't count as the most absurd COVID-related directive by Chief Health Officer. That honour goes to Queensland, where Dr Jeanette Young stepped in to ban an Anzac Day flyover in the name of COVID safety. Yes, pilots flying in formation presumably present some sort of an unacceptable risk of infection. And Queensland Health also advised Brisbane residents earlier this year to wear face masks when driving in their own cars, even when alone. That rule got changed only after much mockery and outrage from Queenslanders. I don't know, perhaps it's not a great idea to give unelected health bureaucrats unprecedented powers.